Good morning and warm welcome to all the dignitaries, pediatrician all over Maharashtra to today's session of PATH. Myself, Dr. Kalyani Patra, Secretary AHA Navi Mumbai and EB IIP Navi Mumbai. I welcome you all today here for a very interesting and very useful discussion on stress in adolescence. I welcome today's esteemed faculty, Dr. Padmashri Dr. Pukhraj Bafna sir, Dr. Sandeep Kekar sir, and Dr. Sanjay Ratnaparki sir. I also thank Dr. Ram Gopal Chejara sir, President Maha IIP, Dr. Amol Pawar sir, Secretary General Maha IIP, Dr. Atul Kanikar sir, Mentor and Chief Coordinator of PATH, Dr. Sulbha Pawar, Secretary Nashik AHA, Dr. Sangeeta Lodha, President Nashik AHA for running this wonderful program for last more than 1 year. Maha IIP and IIP Nashik is running this program for last 1 year, and today we are bringing you a very important and we can say need of the hour topic, stress in adolescent. Now I request Dr. Atul Kanikar sir, who is the vision behind this path-breaking initiative, and he is an adolescent expert from Nasik par excellence. He has been instrumental in bringing all these important topics to all of us pediatricians, which are very relevant for our clinical practice. I request Dr. Atul Kanikar sir, please take this program ahead. Sir, unmute. Sir, unmute.
Thank you, Kalyani Patra madam. I must congratulate you for looking so good today. It's a pleasant Sunday for all of us.
Thank you, sir.
Yeah. And we have such esteemed speakers on a very delicate topic. And we are seeing stresses at all ages, but maximally in the, I would say, middle teenage, that is 14 to 16 years. Recently, we had so many cases. I had so many cases in my clinic where I saw teenagers and the entire family under tremendous stress. And we need to find immediate cause and prevention measures for the late sequelae of stress. So we have Dr. Sandeep Kelkar sir, Dr. Sanjay Ratnaparki sir from Yotmal. यवतमाल के है क्या सर तुम? अरे यवतमाल के तुम क्या बोलते हो?
Yes, yes, sir. Yes, sir.
I am from Vidarbha, so I know.
Namaskar, namaskar, sir.
And my mentor, my teacher, my youngest adolescent care pediatrician from Rajnandgaon, Dr. Padmashri Pukhraj Bafna sir. So these are the people who have taught me so much, and I am blessed to have such people on this particular platform. So without wasting much of time, we have been conducting this program for last 1.5 years, Kalyani madam. It is not just more than 1 year, it is 1 year and 5 months. And I am sure with the zest and the number of participants who are on the rise, we will continue this program as long as the teenagers' issues and our efforts to resolve them, they exist, and I think they will be forever. In fact, the teenagers are 1 step or 10 steps ahead of us. So we need to speed up. We need to orient our own pediatricians on these particular topics. And it's not the teenager stress; it is stress for everybody. That is the motto that we wish to. Because we see so many parents also who are under tremendous stress, so many teachers and so many caretakers who are having tremendous stresses, and these three giants will enrich us on our existing knowledge of stress management. So over to you, Dr. Sandeep Kelkar sir. I think you are the first speaker for today.
Sir, Dr. Sanjay,
Okay,
Ratnaparki sir.
Ratnaparki sir.
Ratnaparki sir.
Sir. Please, you can share your screen and start your talk. No problem.
Okay, sir. Good morning, everyone. I'm not giving any screen or something. I'm interacting. I have interactive section.
क्या बात है?
So, humbly salute to Kanikar sir, my teacher Sandeep Kedkar sir, Bafna sir, Kalyani madam, and everyone who is really honorable contributed a lot in the field of pediatrics. Since whenever a topic of stress is taken, anytime, we always start how problematic stress is, how it is affecting the problem, how it is creating the problem, and then again we go in similar pattern. But today we are having a different perspective. So the stress is the greatest boon to us. Greatest boon. There is no stimulator apart from stress, but we have a different perspective. We always have a different perspective. This reduced steroid, this produces so many disorders, it creates a lot of problems. Absolutely not. And we are going to have a different perspective to look at the stress. Let me ask you a question, everyone. Everyone. If you are appointed as the chief monk of the Tirupati Balaji Mandir, chief puja, will you accept that job? Just think for a moment. He is near the God. Second, he is getting lot of money. He is being respected by everyone. Everybody waits for his appearance. And everything is available what we want in life. Just think for a moment, will you accept this job? Just take a moment. Anybody can answer. Whatever the dreams of goodness, wellness we have, they are fulfilled in the chief monk of the Tirupati Balaji Mandir. But I'm sure nobody is going to accept this job at all. Why this is so? Just think, this is something new brainstorming. Why this is so? Can you think? Because there are no challenges in the life of that. They stagnated life. It's totally monotonous life. There are no problems. Let me frame another question. If you want a husband for your daughter, will you take a ghar jamai? Your daughter will be with you. You can give everything, but you are not still going to accept it because without stress, not possible. The stress is, therefore I tell you, stress is the greatest boon. Then we are talking that it produces this. Yes, that is there. But there are people, means in the desert, the cactus grow, can take the nourishment and can flower with the beautiful flowers. This is what stress is. Why we are looking the stress as problem division? So stress is going to produce the effects on the body if we allow those effects to happen. So today we are going to have this different vision we are going to cultivate, and we are going to learn three important things. One is stress load, because it's a different perspective. Second is stress lens, and third is stress signature. You'll be surprised to know what is these things. So just go within your body and moment. Everybody of us had lot many stresses, and these stresses have affected our five levels, maybe cognition, maybe emotion, maybe sensation, maybe breathing, and our energy patterns. And this has caused either compression or expansion. But now, if you go within yourself, you find this introspective attitude, the stressors are going to produce the load on yourself. And is it affecting your daily life? Even adolescent, is it affecting the study? Is it affecting the curriculum? Is it affecting the sense of well-being? And if this is affecting the sense of well-being, then this load can be calculated. And first estimate the load of stress on the physiology of the adolescent, which is happening. Are you very clear about this? The first thing, is it affecting the activity daily? Is it creating the damage to the happiness index of that particular adolescent? The first thing. If you are able to calculate the stress overload, Firstly, then it is there two important things, either to put the load on the head or either ride on that, and then make the path very clear. These are two important perspectives, and this change in perspective is very important. The change in perspective very important, and therefore always calculate the stress overload. I mean, very clear, very clear. And it is this time to go within yourself. Is your medical practice causing stress overload? Is education causing stress overload? Is causing parent overload? Yes, that is very good. Second important aspect of understanding stress is the stress lens. What is stress lens? Again, this is there are two important words: interoception and exteroception. You can close your eyes and go within you and find out these are the stressors in my life, and they are producing these effects, producing tension, headache, producing restlessness, producing anger, producing instability. Then this is the lens. So I invite everybody to inculcate the ability to find the stress lens, that this stress lens is causing these effects. And therefore, the next step will be just go with yourself what the stress is causing the effect on our own body. And if you're able to identify the lens means where is affecting? It is affecting the head, is affecting the breathing, is affecting the posture. I'll just give a very simple example, a very simple practical homework for you. Just put your neck down, take the hands like this here, and say, I am feeling great. You can say, practice this. Just practice. Put your neck down and say, I am feeling great. And then open the eyes and say, I am feeling great. Same words can produce tremendous change if your body language change, your approach to that part is change. So this is a stress lens to be cultivated from this angle. Are you convinced of this? Very important. And everybody should cultivate the lens to go inside and find out how does that stress affects a snake. Can be a stressor to a coward, but same snake can be a challenge for a snake handler. So it is totally change of perspective. The third very important aspect is the stress signature. What is signature? Whenever a stressor is coming to us, whenever it is affecting the body, and whenever affecting the whole physiology, and when a load is created and you're looking at, you have a signature. What is signature? If you're talking very fast, if your hands are shaking, if you are restless, so restlessness is a stress signature. If your window of tolerance is very less and you're angry with everyone, shouting at everyone, this becomes the signature. Are you convinced of this very important point? If you are walking very fast, this becomes the signature. If you're feeling sad all the time, this becomes the signature. If you are just can't tolerate your parents, can't tolerate your teacher, and just are fed up of yourself, this becomes signature. And this signature is the most important part to identify, and is always a person-specific signature. Everybody is having signature, our own signature. So stress signature is the new introspective understanding. So just go with it. What is your signature? Whenever a stressor is coming to you, how do we behave? What are the thoughts coming? What are the emotions coming? How do you feel inside? How your body language saying? How your breathing change? And what happens with you? And cumulative effect of this signature within yourself is causing allostatic overload. Means A plus A plus A plus A play. When it is happening inside, then it is going to produce the load, and whole the boat is loaded with the load, and you start sinking in the disorder, and therefore you can't come out. So gone are the old days that stress is a problem, it causes steroid, it produces this. No, it's not. It is your whole system, how it responds to the stressor, and creating your own signature is possible. Are you convinced of this very important? Stress overload, which you have to get access. Same stressor can produce no load, or same stressor can produce a huge tons of load. Number one. Then stress lens, are you able to look within yourself? How does it manifest? Where it produces? How your physiology is changing? Stress lens. And third very important, what is your signature? How does it manifest within self? If these are three things we have understood very clearly, you can understand every disorder. You can understand hypertension. You can understand migraine. You can understand lack of concentration. You can understand anxiety. You can understand anger issues. Everything you can understand. Okay, and this view is very, very important. So again, stress load number one, stress lens number two, and stress signature. If you just for a moment go within, apply, and therefore we are not going to accept the job of head monk because there is no challenge. Our life is beautiful because we have challenge. Our life is fantastic because we solve the problems. And when you solve the puzzle, when you solve the problem, you feel happy, and that's happiness is the reward which you get. When you overcome, so choice is yours, either to submerge in the stress, get drowned, and go to the under surface, drown yourself. And second is go up, learn swimming, learn navigating, learn tackling, change your signature, you will be the winner. So this direction is very interesting. I want to inculcate in everybody's, and this is useful not only for adolescents, is also useful for pediatrics also. We are really stressed. We don't change our signature. Even if we are sitting here, we always have back of mind something which is going on. Understand that lens. You can see your ACTH, you can see your cortisol level, you can see your adrenaline level, everything you can see. And that's interoception capacity. If it is achieved, thing can transform, thing can change. And we are wise enough to understand this. Therefore, we are humans. We are still more wise humans to understand because we are medical, we have learned this. But why doctors are suffering? Because we are not wise enough to implement this, take actions, and make everything funny, happyful. Can we happify? Can we make the life interesting? Can we make the communication interesting? Then the load will not be actual load. Load will be fun. And that is what I want to say to you. Thank you very much for giving me this opportunity.
Great.
Okay.
If allowed by the moderator, Kalyani madam, can I say something?
Yeah, yes, sir.
I was just wanting to ask few questions to Dr. Sanjay Ratnabarki sir. He has, without any slides, I think this is the first presentation of any speaker without slides. It was so very spontaneous and beautiful.
Thank you.
Uh,
Thank you.
the thing is, oh, when your family members were wandering in the house behind you, sir,
Yeah.
so you were a little worried or wanting to, you were
I
okay.
was, sir, I am taking Masti Pathshala here. There are some kids which are coming to learn with Masti. This complete 7-day program. Those
Yeah,
kids are
but
coming here
there
and
was
there.
some 40-year-old kid also who entered.
They are there. Everybody come kid like this year. And we enjoy everything like this year.
Yeah, but your hairstyle doesn't suit what you say. Doesn't matter. That is what I wish to say. It was an excellent eye opener for the discussion. But humor is sometimes a very good stress reliever. That is what I feel.
Yeah.
I mean, Sandeep Kelkar sir and Bafna sir are much better than what I know. But it was a beautiful session, sir. And as you said, youth stress is essential. It's life saving. Distress,
Yeah.
which is mainly made by us. Okay. Stress into distress is our contribution majorly.
Yes.
So that is in our hands, and we should focus on that. That is what you wish to say, not only for teenagers, even for younger children, middle-aged people, parents, teachers, and even oldies, our own parents also. Many times we tend to ruminate things which have nothing to do with the present, but then we disturb ourselves, and that is what you wish to say, if I understand you correctly. So we'll move on to Sandeep Kelkar sir, who has been waiting with all the books at the background. Very fantastic collection, sir. So over to you, Sandeep Kelkar sir, who is actually going to teach us about mindfulness. And Kalyani madam, you wish to say anything?
Uh, thank you, sir. Thank you, Dr. Ratnaparki, sir, for a wonderful insights on stress. Dr. Nishikant Kotwal sir has joined. I'd like to welcome him. He is President AHA Maharashtra. Welcome, sir, for today's talk. Sir, would you like to say something? Nishikant Kotwal, sir. Okay. We'll go ahead with the program.
Okay, Kalyani madam, I wish to suggest that we have forgotten to formally introduce our speakers.
Yes, sir. That's what I was asking.
We don't know who is Dr. Sanjay Ratnaparki is from Yotmail. So Vidarbha ke hai, so that is all that I know, and he is probably our Maharashtra AHA executive board member or something. I don't know. But then I would request you to submit the formal introductions of the speakers.
Yes, sir.
As far
Yes,
as
sir.
Pukraj Bhapna sir, I can introduce him no problem. There is no problem for me.
Okay, sir. Actually, we had done already completed Dr. Sanjay Ratnaparki sir's talk. Sir has got immense work in pediatrics and adolescent health, and he has been trained in field of psychology, also in field of yoga and meditation. Also, he has done sports training, and presently uh, he is doing teaching programs for students, parents, as well as adolescents. And he has conducted many such programs for adolescent in his tenure. So this was Sir CV is 8 pages. So this is something I have shortened.
Basically, he is stationed at Yotmal, that is Vidarbha.
Yes, he is from Yavatmal.
Yeah, he is doing a lot of work there, and that is what you wish to say for all the sects of adolescent care, parenting, teachers, and all that.
Yes, sir.
What about our Kirkit sir? Kirkit sir,
Sandeep Kekar sir also needs no introduction. As Atul Kanikar sir already said, these are the giants in the field. What we have, we are fortunate today to hear here today for this talk of stress management. Sir is a director at MRM Children's Hospital, Thane. He's founder director Equipose, the Certified Emotional Intelligence Research and Training Organization. He has got certification from Child Mental Health, Stanford Medical Center, USA. And he has been instrumental in teaching the emotional intelligence to all the uh, parents, teachers, and doctors as well. So I request Dr. Sandeep Kekar sir to go ahead with the talk. Thank you, sir.
Great.
Thank you so much, Dr. Kalyani, for that kind introduction. It's a privilege to be here on this platform. And amongst all the dignitaries, my co-facilitators, I thank the PATH organizers at the outset for having this important topic for discussion. So today I will be speaking on mindfulness, how we can utilize this important tool in stress management. So do I have access to share?
Absolutely.
So as Dr. Ratnaparki has already mentioned, that stress is something which has been mistaken, miscommunicated. It's not about the outer situations which happen in teenagers' life which cause stress. It's about inner situations which happen in them, which actually can be managed very well. And that's what we are going to focus today, is how to manage our own mind as well as body, and how we can help and support teenagers to manage their mind and body so that there is less of stress. So instead of managing stress, I would focus on stress reduction, because that's how it has been, studied and researched all over the world, is how mindfulness can be really useful in stress reduction. And I myself have gone through this scientific research and courses on this called as mindfulness-based stress reduction, done by Massachusetts University. And my talk will be based on whatever I have learned from there. So as we know that, today's 21st century world is full of stress, and children, especially those are teenagers, they can have different situations where they can, different situational stresses which can happen. But they can have certain tools like mindfulness, which can really help them to reduce the stress and do kind of stabilize their mind and can navigate through the stress very well. So that's why my agenda for today's talk and my goals of today's talk, I'm just going to introduce to you about how this mindfulness and stress management or stress reduction are intricately related and how they affect each other. And of course, what is mindfulness? Because for some of you, it may be a new concept as such. And what are the benefits of mindfulness for not only children, adult, teenagers, but for us as adults also? Apart from reduction of stress, there are many other benefits. And of course, what is the neuroscience behind this concept of mindfulness and stress reduction? Because as we know, we need research, need evidence, and there's a lot of evidence coming up in last 2 or 3 decades about how effectively mindfulness can reduce stress. And of course, I will end my talk in last 5 minutes in the end with some tools which can be given to teenagers so that they can have stress reduction. And if I get time, I will be actually taking you through a mindfulness exercise if time permits at the end. So let's move to first, what is the role of mindfulness and stress? If we understand stress, as rightly said by Kanikar sir, that it's basically distress which we are talking about, because the eustress is important, but something happens that stress overwhelms us or the teenagers, and that causes impact on everything, mind, body, everything, and that is what needs to be actually reduced. Rather than managing, it can be reduced. And as we know that stress happens, why this stress happens? Because many children as well as teenagers just go through these stressful situations. They just breeze through it without stress. Why, what are the skills which are there in them that can be really helpful to them to breeze through? So it's about mind, it's about body, and how we regulating it with our attention. Okay. And that's very important concept, and that's what is mindfulness is telling, because stress is about when there are certain situations confronting us as well as teenagers which are really stressful, negative. uh, it affects the mind, it causes a lot of things inside us, and then we go into a reactive mode, and then we react. Our actions are such that which may not be very helpful, but they may be harmful also. So many a times stress happens because either we are in the future worrying about something, so we first worry, then we worry about worry, and then we worry about why we are worrying. So it's a kind of cycle which we are set in, and we are not in the present moment at that time, but we are not in the our mind is not in the activity which we are doing, but we are somewhere else in the future, and we make and create that self-created psychic pain, isn't it? Or sometimes we go into the past and dwell into something which we did, and we feel really frustrated or guilty or embarrassed about something which we did. So what happens is we are not in the present moment here and now, paying attention to this moment, which is what is life made of actually. And we have finite moments to stay here. So either we are in the past or we are in the future, and that creates a lot of stress. And when the stress happens and when it is distress, most of the times it is being found that we use certain strategies which are very ineffective. We suppress them. We either deny that, or we are not aware about our triggers, as rightly said by Ratnapaki sir about stress lens and stress threshold and stress load. We are totally unaware about what's happening in us, and we are just driving our life by chance, and that's how the stress happens. But if we know we have certain tools like mindfulness, we can actually go inside us ourselves and use our mind to change our brain so that we can actually help ourselves reducing the stress. So there has been a lot of research, and mindfulness research has galloped like anything in last 1 or 2 decades, as you can see. And PubMed has published, mindfulness research in teenagers as well as children, and the literature is skyrocketed. Virtually none at around year 2000 no, now indexed more than 600 index publications in 2015, and now the number is even more increasing. But what is striking is the key research findings done on mindfulness and stress reduction in teenagers by different universities all over the world. And one is where I have come across is Stanford University, where they conduct 8 weeks mindfulness training programs, where they actually teach these tools of mindfulness to sixth graders around. And that has found really a statistically significant change in their improvements of their attention, reducing their anxiety levels, and they're better able to handle daily stress. And of course, another study which was done at other university, where there was a study done for psychiatric patients of adolescent age, and from which they found that just mindfulness training helped them to reduce their stress, anxiety, and depression symptoms. So that's a real science which is coming up, and that's very important that we should take help of that research also. So as you can see on this slide, this is a common situation, right? In teenagers' life, the teenager is trying to focus on something which is there, maybe calculus in math. And what is happening is his mind is full rather than he is mindful. His mind is cluttered with a lot of thoughts about a lot of things which are happening in the life, maybe future, past. And the total mind clutteredness is there, which causes a lot of stress. But he can be mindful, where he is focusing on one thing at a time in the present moment, and of course all that non-judgmentally. So what I'm going to now show you is about what mindfulness is and how it's going to actually have impact on our stress levels. So what is that exactly? What is mindfulness? Because there are many misconceptions about mindfulness, and it's actually in a dynamic form of meditation where you can do this anywhere, anytime. You don't have to sit or go to some resort or some place out to do this. You can do this process called as mindfulness, which is intentional process, by paying attention to something in the present moment, all that non-judgmentally, with some certain amount of attitude, which is called as coal attitude, COAL, with curiosity, openness, acceptance, and love and kindness. So it's not just paying attention. It is not just awareness. It is awareness in certain way. It is a attitude of coal, with curiosity, with openness to all pleasant, unpleasant sensations, accepting what is there right now, and with a lot of love and kindness to self and others. So that's very important attitude, and all that non-judgmentally, because we judge things a lot, right? About what is happening to us, and we have thoughts about thoughts, and it escalates. And this happens with teenagers also. So this is the definition which we are going to focus, and we can see that it is a attention with intention, which is more of a kind attention, where it is, your loving kindness about yourself. You're not harsh, you're not judging on yourself. So this is a very important tool, and this may sound a little theoretical, but when I take you through an exercise, you will find out what exactly, because something can be anything. Something can be breath, something can be, you can pay attention to sensory signals all over the place. Something can be what you are eating, if you are eating right now, whether you're paying attention to this present moment without judgment, with that cool attitude. If you can do that, you are going to have a mindful trait. And as you go and it becomes habituated, it's more becomes a kind of habit and trait in you, which helps ultimately in reducing the stress. So if you have a mindfulness, being mindful is very important, where you are that person who can be at a stabilized mind in the present moment, going rather than your mind wandering to future or past, and you are stabilized in this present moment. So that's about mindfulness. But then what about this attention? Because there is a lot of research done on attention also, because mindfulness is about attention with kind intention, or attention with kind and gentle intention. So there are three types of attention which have been research proven. First is exogenous attention. When I am saying that, you are right now attending to this course or this, talk, and if I make this sound, now your mind is pulled by that sound. Okay. So something outside pulls your attention. It may be sound, it may be thoughts, it may be memories, it may be anything. There are a lot of mental activities which we have going on in the background, which can pull your attention, and it's called as exogenous attention. Okay. Then there is something called as endogenous attention, something which you can choose to pay attention to. For example, even if you are right now thinking of something you want to do during the Sunday evening, you can bring your attention and choose to pay attention on my talk, what I am saying, the words, okay, the tone, whatever. So this is choosing, this is by intention. It's called endogenous attention. And the third type of attention, which has been research proven, is now called as executive attention. So if, for example, if you are right now focusing on my talk, that's endogenous, you are choosing to pay attention, but then something happens and then your attention is pulled by something out. So maybe sounds, maybe thoughts, something else. Now at this point, you notice that your mind has shifted, and then gently and lovingly bring it back. Okay, bring it back to the talk, or bring it back to what I'm saying. That is called regulation or execution. And this executive attention is most important in mindfulness, which is actually useful for stress reduction. Because when your mind is cluttered, your future, past, then you create a lot of thoughts about thoughts and then intense emotions, and that causes a lot of problems. So what is built during mindfulness practice is this executive attention and regulation. And regulation is about monitoring and modifying. Okay, you monitor whatever is going on, maybe your breath, and if it wanders, mind wanders, you bring it back. So that's modifying. So it's about monitoring and mind. And there are immense benefits of mindfulness, which have been research proven now. Apart from reduction in stress levels, you have increased emotional regulation, you have better relationship skills, you can have more focusing and attention, which is now a problem all over the world, is the focus. And then, of course, your working memory is improved. Of course, in children and teenagers, the test anxiety is less. ADHD has been researched that children are taught with mindfulness techniques have lesser ADHD behaviors, and they can improve with mindfulness-based different exercises. So these are many benefits which have ultimate impact on mental health. So mental health is governed by thoughts, feelings, and actions. And if you are aware about all these things, and if we can monitor and modify them, we will have a better mental health. And that's the basis of how mindfulness helps in stress reduction as well as in better mental health. And why it's exciting for all of us as pediatricians is because stress reduction and stress management and mindfulness are integrated and intricately related because of the underlying neuroscience behind it. And I got fascinated because of this concept, because there is a lot of science going on inside. Because when you see somebody meditating or doing mindfulness practice, you see that that person is just sitting there, maybe closing the eyes, and just nothing seems to happen. He's just breathing, isn't it? Nothing seems to happen. He's just focusing somewhere. But in fact, enormous things are happening in our brain when you are just doing 2 minutes of mindfulness practice also. There is enormous things, and that's the science behind it, which is very important we should know, because once we have neuroscience behind it, we have more conviction in applying this tool for ourselves as well as children. So what's the science behind this? As we know, it's the new concept of health and wellness is what is called as integration. And integration is about different parts which are separate, which are connected to each other. For example, take an example in orchestra. In orchestra, there are different instruments. Like we have, drums, we have guitar, we have keyboard, everything. They have unique functions. They are separate, but at the same time, they are linked so that the orchestra becomes melodious. So in same way, in our body as well as in our brain, there are different structures. There are different brain areas which are, separate. They have unique functions, but they need to be connected and linked also. If there is too much of linkage, that produces a lot of symptoms. And if there is too much of separation, that creates a lot of symptoms. And in fact, DSM-5 criteria, and if you have all the symptoms, which can be taken into either symptoms of either what is called as rigidity, where there is too much of connection, and there is separatedness, where there is, for example, anxiety is too much of separatedness, depression is rigidity. So what I'm talking is about integration, and integration is balance, where everything is in balance and in connected to each other. So as you can see in this brain model, where with the advent of functional MRI and PET scans, now we know exactly what's happening in the brain when you're doing mindfulness practice. Actually, you can see live what's happening inside you. And what is happening is something happening in the prefrontal cortex, which we call as emotional manager or key integrator of the brain. And especially the medial prefrontal cortex or MPC, which regulates our attention, which regulates our body, which regulates our mind, is the key integrator. And what mindfulness is doing is actually activating middle prefrontal cortex. And that's what research has proven, that just doing even 20 minutes of activity of mindfulness exercise daily for 3 weeks will improve the neural architecture in different parts of the brain which are necessary for stress reduction and mental health. And of course, we have amygdala also, which is kind of fight and flight response, this thing organ, which many a times responds to threat. And stress is about anything which is perceived as threat. The amygdala starts firing, and it then aggravates and connects to the sympathetic system, which goes into override. And then we have palpitations, we have increased heart rate, we have sweating, all those stress symptoms and are there through amygdala. So what middle prefrontal frontal cortex does, and this mindfulness practice does, is regulate the activity in the amygdala. It dampens the activity in the amygdala so that we have less of all these sympathetic activity and have more of parasympathetic activity. Actually, it stimulates the vagus nerve. And if we want to live life happily, we should be having training on vagus nerve. That's it. If we can manage vagus nerve, we will be happy and we will be able to manage our life with stress reduction. So as we know, what happens when you are stressed out, sympathetic and parasympathetic, and mindfulness actually can actually stimulate this vagus nerve and actually have lesser of stress all over the body. So to conclude my last 5 minutes, if I have got 5 minutes on just tools which we can actually give it to children or teenagers for application of mindfulness in stress reduction. And what they can do is they can inculcate mindfulness in their own life, right from the time they wake up in the morning to the time they go to bed. It's not that 24 hours you have to be mindful. It's not that. But even if you practice 10 to 15 minutes of mindfulness every day, it's going to change the neural architecture in our brain so that you can fight off, you'll be more resilient, and the teenagers will be having less of stress. So what are these different tools which we can give them? One is mindful breathing. So that paying attention to something one can be the breath sensations. So can the teenager be told and just taught about mindful breathing, which will be really useful, just focusing on your breath sensations, wherever they are happening naturally to you. And when the mind wanders, bring it back. When the mind wanders, bring it back. That's it. And that's a, mindful breathing practice, which, as I say, may sound really easy, but when you start doing it, you will understand that it is your mind starts wandering many times, and then you have to bring it back. But that's the practice, that's what we call as mindful breathing practice. So that's one tool which we can give. Secondly is very important, because most of the times these intense emotions cause a lot of stress in children. This may be anxiety, it may be scare, uncertainty about the future, maybe sadness because of broken relationship, disappointment, frustration. All these intense emotions can be managed through a technique, which is a mindfulness technique called as RAIN. And RAIN stands for, acronym again, RAIN, recognize. First, recognize and identify what you're feeling, give a label or give a word to the feeling, because what happens in our brain is, it's called as name it to tame it. When you name your emotions will, intense emotions activity will go down. So just recognize, identify, and label your emotions, then accept this is what it is, and don't try to deny the thing. Allow yourself, allow, accept, and acknowledge. That's for A. And then investigate what's behind this, what is causing this. And then instead of emotions and thoughts taking over you or the teenager, he will be able to manage it more. And then non-identification, where you are discerning yourself, you are separating yourself, the way you are saying to yourself that I notice that I am feeling stressed out, rather than I'm stressed out. So that's about non-identification. So these are few of the techniques. It's a RAIN technique which we can actually teach and give to teenagers, which can help in reducing stress levels in children. And of course, we do for children as well as teenagers what's called as mindfulness glitter bottle, where they are given a bottle where it's full of water, and we ask them to open the cork, put glitter into it, and turn the cork, switch it off, and then actually shake it and just keep it in front of you and just observe the glitter. That's it, nothing else. As the glitter settles, the child starts feeling calmer, because what he or she is doing is exactly a mindfulness exercise. Okay. And we then relate this to mind also, because in mind also similar thing happens. When there is too much of glitter of thoughts, the thoughts about future, worrying thoughts, anxious thoughts, all those, they can settle if we just focus on one thing. So that's how mindfulness glitter bottle is another thing. And just to wrap up, just last slide, very important to have parenting which is mindful, because just parenting and how we respond to children's emotions and children's whatever they're doing behaviors in a mindful way, it's called mindful parenting, which is going to have impact on teenagers stress levels also, not only the parent stress levels but teenagers stress levels also. And what's about mindful parenting is about paying attention to the internal world, what's going on, rather than the whatever external things going on. Being non-judgmental acceptance of self and others, be aware, then co-regulate. If the child is really angry and coming to you, you start getting, uh, reactive mode inside you. So first regulate yourself and then regulate the child. That's called co-regulation. And then when ruptures happen, when something, you think that you're done wrongly, and some wounds are created, some ruptures happen, go back and repair. That's very important. So all this will lead to what is called as mindful parenting, and that will lead to stress reduction in teenagers and children. And I think I will conclude my talk with a few of these tools. I think my time is done. So if we have time, then 2 minutes of uh, just exercise we will just end with. Thank you so much.
Thank you. Thank you, sir, for the wonderful talk on mindfulness. And you have given us a lot of tools how we can incorporate this mindfulness, and also a very important tip for parents to be mindful themselves.
Madam, if there are any questions, otherwise we will straight on move on to the next talk, and then if there is time, then we will have our questions. As
Sir,
far as Kelkar sir, I have few questions for you, which I have already submitted to the moderator, honorable moderator, Dr. Kalyani madam.
yes, I will. I have few questions, sir. Dr. Sandeep sir. We have been knowing that there are mirror neurons which work for children, and so what is the exact age we should start teaching mindfulness to our children? Is there any advantage of teaching these things early?
Yeah, absolutely. And we can teach mindfulness uh, skills to as early as even toddler. And how do you do that? Because they cannot be intentionally focusing on something, right? So there is one interesting exercise which we can give a toddler. It's called breath buddy meditation. So when they are lying on the supine on their back, keep a soft toy on their abdomen. Okay, and just tell them that when the soft toy goes up, you say up. When the soft toy goes down, you say down. So what they are actually doing is they are focusing their attention on the breath. But we are not telling them to focus their attention on the breath, but the soft toy. It's called breath buddy meditation. And you can do this, and I give it to many children which are, a little bit impulsive, hyperactive, and, have difficulty in paying attention to one thing right at, early age. Ask the, parents to do this breath buddy meditation all together. All family members lie down and keep soft toy on their abdomen and just up and down, and just they are just focusing on their breath actually, and that helps in calming down as well as regulating their attention, and helps in reducing all the symptoms which are seen in sometimes in ADHD early, hyperactivity, impulsivity, and lack of attention, which is there in early red flags of ADHD. So this can start as well as early as after birth also. You can actually ask the parents to focus when they are with the child, as rather than allowing them to be on the screen for first 2 to 3 years. Just have face-to-face communication with eye-to-eye contact, and doing certain pro-socially and pro-actively with the child. That is what we are doing, is actually teaching them mindfulness, isn't it?
Kelkar sir, you have reminded me of my grandmother who used to put me in her lap and tell me stories, and then I used to imagine, and that
Absolutely.
was the best mindfulness that
Absolutely.
I
Wonderful.
had.
Thank you for sharing that.
Yes, please. So, Kalyani Patra, any other things you wish to, or it's already 11:30
Yes, sir.
now?
Sir, one thing, one interruption we have. We have a important announcement to make. So I request Dr. Abasaheb Patankar sir to do that, please.
Yeah, thank you, Kalyani madam. Thank you, Dr. Kinikar sir. Thank you, the organizers, for giving me the time. I am Dr. Abasai Patankar, pediatrician from Raigad IIP. I am here for announcement. We, along with NLF Maharashtra, have organized Mahanayokon 24 in Mumbai Vashi at Sidco Convention Center on 21st, 22nd, and 23rd of June 24. So a very short time is remained. So I am here for announcement to appeal you for registering the conference. This conference has been uh, uh, this conference is going to be on 22nd and 23rd, and on 21st there are going to be workshops. We have workshops on simulation, we have workshops on non-invasive ventilation, advanced ventilation, NRP, HINA, and at the same time we have workshop for nurses also. So the able leadership of Dr. Mohite sir and Dr. Sanjay are the president of Vikas Mode is the president of IIP. We are working very hard to make this conference successful. So I appeal all you, please register and spread a word in your basically your groups.
Okay. Kalyani
Registration fees around 7,000 rupees. Early bird is around 6,000. With your contribution and your help, we are going to definitely make this conference a great success. Thank you, Kalyani madam, and thank you organizers for giving me time. Thanks a lot.
Thank you, sir. I'll request Dr. Atul Kanikar sir to please introduce our next speaker, respected Padma Shri Dr. Bukraj Bafna sir.
Sarji, pranam.
Pranam.
Bukraj Bafna sir, basically he has his introduction on the screen, but He is one person who is an idol for me. Idol for me. I have learned so many things from him, and we have been associated for more than 25 years in the AHA and IIP. And he has so many awards in his pocket. And he is one person, very humble, does not boast about his achievements, working in a very intricate area of Rajnandgaon, that is Chhattisgarh, all jungle area, working with tribal teenagers and delivering his best. So, for which he has received that Padma Shri award. He is one of the few Padma Shris in IIP all across the country. And even today, he is doing so much work for the tribal teenagers. And I have had the privilege to meet him, and very lovable person. If at all you get an opportunity to meet Raj Bapna sir, feel yourself blessed that you have met the right person at the right time. With all this brief introduction, Bapna sir, over to you for your presentation.
थैंक यू अतुल भाई. सदियों से मिल रहे हैं, पर लगा पहली बार मिले, और पहली बार मिले तो लगा सदियों से मिल रहे हैं.
क्या बात है. He is an excellent poet also. He does spontaneous poetry. तो कल्याणी पात्रा मैडम बच के रहिएगा, आपको भी नासिक में मिलेंगे तो he may throw a poetry on you.
अतुल भाई, I am sandwiched between the two experts. दो बड़े बड़े महान विद्वानों के बीच तुमने मुझे बुला लिया, और इतनी अच्छी बातें उन लोगों ने कही हैं. There is nothing left for me to say.
तो चलो शवासन करते हैं फिर.
Because you have Ratna Parki with you.
Yeah.
You yourself, आप खुद अतुल्य हो. कल्याणी आपके पास है, and many people are there. Anyway, I'll just try to summarize what people have said, what these people have said, because जितनी बातें उन लोगों ने कही हैं वो बहुत बारीक, बहुत अंदर तक जाने वाली, और ऐसी बहुत सी चीजें which people do not know. But I'll just in few minutes some basic things. Actually, the topic which have been given to me is stress management through yoga therapy. So let us see what we can do. I share my slides.
Please.
Can you see the slides?
Yes, sir.
Okay. In one word, in one sentence, if I say, which Dr. Ratna Parki said, that stress is body's response to any unpleasant situation. And this is the 10th life skill, which WHO has told us, coping with stress. 10th life skill. Friends, adolescent stress is confusion. He is mentally blocked, and he is uncomfortable whenever he is stressed. Apart from applying the life skills, which everybody has told about mindfulness and other things, they engage in following the inappropriate and many times harmful shortcuts for stress relief. But what yoga can do? There was a question which Dr. Sandeep was answering about when to start. Of course, even when the fetus in the embryo of the mother, that the yoga and the mindfulness can be started. But yoga can be started after the age of 8 years, because then only the child understands what steps to be taken. Anyway, next one. Yeah. What is stress has been told by both the speakers. What is stress management has also been covered in a best way. But role of yoga in stress management is very common these days. Baba Ramdev and other people, and most of the not only the Ayurveda people or yoga people, but even our colleagues, they are using yoga as a tool for the treatment. Everybody knows the types of stress, eustress and distress. Eustress is positive stress and challenges to adopt and grow. That is eustress. That everybody should have. And as very well said, that without stress, there is no life. The example was given by Dr. Ratna Parki of that temple, the monk. He was without stress. So what is his life? It's all loneliness, nothing doing. And distress is negative stress, can deplete or destroy the energy of life. Destroying the energy of life is something very, very important in the adolescent's life, because that is a growing way of life. What are the causes? It can be in two ways: work or organizational causes related to workplace or work. For example, in the school, the college, family, and outside the work, personal, family, social causes. So these can be the causes causing stress even to adults, adolescents, and even to children, of course. Newborn can also be in stress if the mother is not there, not giving breastfeed or not taking her. Now, what are the sources of stress? I'm just telling you these things because these have not been stressed upon by the previous speakers, just to give some basics. There can be family causes. There can be झगड़ा in the family. बच्चों को डांट मिल सकती है, बच्चे घर से भाग सकते हैं, उनकी बात सुनी नहीं जाती है, उनके मन में झांका नहीं जाता है. There can be social causes. Career is a big problem for adolescents. There can be intellectual causes, financial causes, health causes, spiritual causes. These are the sources of stress which a person can have. Symptoms can be physical, can be emotional, mental, or even behavioral. Physical or physiological symptoms can be muscle tension, inability to sleep, excessive tiredness, dry mouth, breathing difficulty, sweaty palms, cold hands, stomach upset. All these are the symptoms of stress in an adolescent. Emotional or mental symptoms could be anxiety, worry, guilt, nervousness, all that, all moodiness, depression, nightmares, loneliness, impaired memory or forgetfulness. All these are the symptoms in adolescents, the emotional symptoms and mental symptoms. Behavioral symptoms, change in productivity, sleep disorders, change in eating habits, serious appearances, as Dr. Kelkar was telling us about the parenting, mindfulness in parenting. So this is the matter where the parents have to take care of their adolescent children. Serious appearance, nervous disorder behavior, increased frustration, overacting, increased consumption of alcohol, and many more. So these are the symptoms to be looked after by the parents. That's why parenting is most important for adolescents. Is all stress bad? As already said, too little stress, it leads to boredom, like that monk. Moderate level stress, that improve performance and efficiency. This is a must. Everybody, every human being in this world, whether an adolescent or an adult or whosoever, he should have this type of stress. And too much of stress that causes an unproductive anxiety level, unproductive life, I should say. What health problems an adolescent can suffer? Heart disease and stroke. As adults, even these days, we are seeing many cases of adolescents suffering from these diseases. Gastrointestinal problems such as ulcers, impaired immune system, insomnia, headache, backache, drug and alcohol use. These are the health problems with excessive stress if the person has. Now, what are the steps to manage? First and foremost would be to identify if you are stressed, whether you are stressed or not. First, you should know कि मैं stressed हूँ कि नहीं, चिंतित हूँ कि नहीं, मुझे तनाव है कि नहीं. That is the first step. I should know whether I am stressed or not. Then identify the stressors. Dr. Ratna Parki has very well said, you must know what is the stressor. किसने आपको चिंता दी, चिंता का आपके तनाव का कारण क्या? Then identify the reason for the stressor. क्यों उसने ऐसा किया? Why this stress is being given to me? And then select an appropriate stress management strategy and apply it. There are many ways. Many ways. The things have been told, very well told by Dr. Ratnakar and Dr. Kelkar. Then evaluate. Steps to managing stress. The fifth step and final is evaluate. Then only you can get success in relieving the stress. Role of yoga. Dr. Ratnakar is the yoga expert, as I have been told in his parichay. So role of yoga is of great importance in relieving stress. I'll tell you in very short what type of yoga can be done to relieve stress. How yoga works on stress. This has been very well dealt with by Dr. Kelkar. In yoga, breathing using the diaphragm, as you breathe, can stimulate the vagus nerve and help reduce the stress. How? Vagus nerve is main nerve of parasympathetic nervous system, extends from medulla through diaphragm to abdomen and responsible for slowing respiration, is a part of yoga, reducing heart rate, lowering blood pressure, stimulating digestive system. In fact, yoga works on limbus system of our brain. Now, what are the asanas which should you do? Uttanasana or Padhastasana, Adhomukhasana, Paschimottanasana, Balasana, Shavasana. And one of the most important, which has not been mentioned here, is Hasyasana. That is a part of relieving the stress. So, in short, I'll deal with, because for stress, an adolescent will not do everything whatever you tell him. कि ये करो ऐसा सब करो, nothing. जो उसके दिमाग में जो उसको समझ में आएगा, वो वही करेगा. So these are the simple few asanas which one adolescent must do when he or she is in stress. What is Uttanasana or Padhastasana? Is a unique pose which you perform while doing other yoga exercises. हम दूसरे exercise भी जो करते हैं योगा के, उसमें भी ये आसन आता है. This exercise is practiced to reduce mild depression, fatigue, and stress. This asana does the unique work of reversing the blood circulation, as the head is below and the heart is in this exercise. You can see this in this picture. This is Padhastasana or Uttanasana. Here you can see the head is low, the heart is just above that, and this is one of the best ways for the circulation. The second is Adho Mukh Savasana. It is amazing stress relieving yoga pose that helps in waking up the sense and reduce fatigue and tiredness, because these are the symptoms of stress. It rejuvenates the body by improving blood circulation again. See, this is how it is being done. Adho Mukh means the face is below. Adho Mukhasana. Next. Paschimottanasana. It can help a distracted mind unwind. Seated forward bend is a basic yet challenging pose with several benefits in addition to relieving stress and anxiety. See, this is Paschimottanasana. This, again, you see, yoga is not a simple exercise. Unless it is with breathing, it is not yoga. My PhD I have done on this topic only, where I took 40 students who did only school PT and 40 students who did yoga for 1 hour for 4 months. And you will not believe the result was 81% of these students stopped taking medicines which they were taking regularly, handfuls of the medicines. School absenteeism was not there at all. They enjoyed AC, they enjoyed ice cream and leading a quality life. 81% of them, those who did yoga, in comparison to the people, the students who did only PT, which is being exercise which is being done in the school. The next is Balasana. The child pose or Balasana is undoubtedly the most relaxing yoga pose that helps in calming the mind and regenerating the body with energy. This is Balikasana. The other way is just let the child sleep in whatever way. That is Balikasana. Holding one leg on one side, the other one on the other side, lying flat. That is Balikasana. That also relieves the stress. And then Shavasana, which Dr. Atul was saying. The corpse pose is one of the most challenging yoga, most challenging exercise. It doesn't mean only lying down. This is a complete posture of relaxation which de-stresses your central nervous system After the exercise, you will feel calm and composed. The Shavasana slows the beta brain waves, and hence the complete body and mind can relax. As I told you, this is not simply lying down. You have to do auto suggestions to your every part of the body, your fingers, your thigh, your calf muscles, thighs, abdominal organs, the chest, the fingers, hand, the shoulder, and the face. You have to give auto suggestion that it is relaxing. इसमें शिथिलता आ रही है. That is Shavasana. And of course, Hasyasana, which I have told you, very common, and that has to be practiced by the adolescents also. The second part of yoga is pranayama. It does not mean just breathing in, keeping the breathing air in and exhaling it. It's not that. It also means establishing control on the entire breathing process and maintaining mental equilibrium and concentration of the mind. This is pranayama. The inefficient functioning of the lungs affects the process of blood purification. It is for the reason the importance of pranayama has come to be recognized for a healthy long life. What are the important pranayams for relieving the stress? Vastrika, Kapalbhati, Bahya Pranayam, Agnisar, Ujjayi, Anulom Vilom, and Brahmari Pranayams. These pranayams, very simple, but Agnisar and Ujjayi, I don't think adolescents will be able to follow you. So simple ones, Bhastrika, Kapalbhati, Bahya Pranayam, Anulom Vilom, and Brahmari should be told to them. Let me tell you, in one of the studies, we did Brahmari Pranayam, that is saying Om for 9 times in the school, in the beginning, at the end. And to our utter surprise, the parents came to us and told us, "Aapne kya kiya doctor sahab school mein?" 2-3 महीने से बच्चा पहले आता था, बस्ता फेंक के चुपचाप लेट जाता था. Now he comes very happy. उसकी मुख मुद्रा, उसका सारा सब कुछ जितना वो उत्साहित, उतना उमंगित रहता है. Then we told him we are doing Brahmari Pranayam. This is how it relieves the stress of studies and everything. See, stress can be physical, mental, because of exam, because of cyberbullying. One of my friends who is in Chicago, I don't know whether she is seeing this talk or not, but she asked me in WhatsApp whether you can do something for the cyberbullied adolescents. That we'll discuss. This is Anulom Vilom. Everybody knows very well. From inhaling from one nostril and the other nostril, exhaling from the other nostril. It's very, very simple. Anulom Vilom, which is being taught to adolescents. This is Kapalbhati. Inhale and exhale with force. That is Kapalbhati. Bhastrika, inhale with force and then exhale. Actually, इसके पहले का दिखाओ. In Kapalbhati, what should we do is, you count for 4, 1, 2, 3, 4 when you inhale, and count for 8, 1, 2, 3, 4, 5, 6, 7, 8 when you exhale. That is the real ratio of inhaling and exhaling in Kapalbhati. Next. So the management would be practicing yoga, which we have discussed. Proper nutrition is also important. Apart from yoga and other things which has been told all by the previous speakers, adequate sleep is important to relieve the stress. Positive attitude, which Dr. Kelkar was discussing in a very nice way. Relaxation techniques, which we have told you, take mind off the problems. That has to be taught to the adolescents by the parents. And of course, meditation, which has been very, very well dealt and explained by Dr. Sandeep. So just few words about meditation. It's mindfulness. It is focusing mind on any particular object, thought, or activity. That is meditation. And meditation is to train attention and awareness. हमारे attention को, हमारे awareness को train हम करें. That is meditation. Meditation is to achieve a mentally clear and emotionally calm and stable state. Meditation is a must. It must be taught to all the adolescents to get relief of this stress. So just some points to ponder. somebody was asking the question, what is the effect of stress in the brain and what yoga does? Yoga can help reduce stress by promoting relaxation, the natural opposite of stress. Relaxation is opposite of the stress. So yoga gives you relaxation, which is opposite of stress. Yoga can benefit three aspects: our body, our mind, and our breathing. Yoga elevates level of a brain chemical that is GABA, gamma aminobutyric acid, for better mood. Lot of mood swings are there in neuroscience, lot of stress. So it works in three levels. The deep breathing and meditation works on hypothalamic pituitary adrenal axis. As I told you, it works in limbic system. So this axis is activated by yoga. Yoga activates function of hippocampus, amygdala, prefrontal cortex, and cingulate cortex, as picture is being shown by Dr. Kilkar. Yoga improves strength, balance, and flexibility. Yoga creates mental clarity and calmness, which is important to relax from stress. It increases body awareness. You should know, अपने बारे में जानना चाहिए मैं क्या हूं, मुझे स्ट्रेस क्यों हो रहा है, किसने किया. Relieves chronic stress patterns, रोज का कि तक्का तनाव. Relaxes the mind, centers the attention, it sharpens concentration. Next. The only thing I would like to say is, it's a natural stress relief. Yoga is a natural stress relief, which one must remember, and you must have some guru to teach yoga. अपने आप योगा नहीं, जब तक आपको ट्रेनर योगा न सिखाए, तब तक without the presence of trainer you should not do yoga. So you need a trainer to watch friends to practice yoga, release stress, and I must thank the organizers to give me a chance to talk to you. But I am really impressed by Dr. Ratnaparki and Dr. Kelkar. Excellent talk they have given. The insight of what stress is and what should you do. Thank you so much.
Thank you, sir, for a wonderful talk on yoga and how incorporation of yoga will definitely going to help adolescent in stress management. There are questions in chat box. We'll go ahead with the questions one by one. This question is for Dr. Ratnaparki, sir.
Yes, madam.
Yeah. How to differentiate between good and bad stress and when to intervene?
Absolutely, very nice question. So any stressor, anything, if it is coming inside, it is going to produce a state called an overwhelming state. मला कसं तरी वाटतं, मला चांगलं वाटत नाही. That is what is called as overwhelming state. This state gradually goes on increase to the peak state. Then it accumulates in one part of body. For example, in migraine head, shoulder as a frozen shoulder, osteoarthritis knee joint, and that becomes the pattern. So if anything which is coming to us, creating a pattern and producing effect, this is a lens which I was talking. Now, good and bad thing depend upon the perspective which you look at. Everybody is having stressor, everybody is having potential to transform oneself. If any person get determined in mind that I am not going to be affected by the exteroception. If somebody is talking bad to me, it is his perspective. I can regulate myself. Was Sandeep sir was talking. So the greatest boon to affect ourselves to practice that self-regulation technique. I am not affected by this thing, and then internal transformation happens because our body is built for that. Our body knows how to regulate itself. So nothing good and bad. Even bad become good and good become bad depending on perspective. Drushti badali, तर सृष्टी बदलते.
Okay, there is another question for you, sir. Is there any role of social media in enhancing stress in adolescent of today?
First of all, the question why adolescents are going for social media. The answer is that as human beings need connection, they are seeking the connection. Okay, but that is a false connection. No touch, no intimacy. So can we create the same connection in the environment surrounding? True sense of happiness, if that is connected. So tell you share, we are having Masti Ki Pathshala just now, which is going on, where kids come. There is only pre-lunch and post-lunch session, where we make Masti and then we direct that Masti into creativity. No child for 7 days seeing the mobile. No child for 7 days is seeing the WhatsApp. It just totally out of, because they are seeking the connection. Yes, this is there. We just dance together, we just sing together, and then we gradually direct the energy to creativity. So this is we need connection, and if we get a natural connection, why go for false connection? That is very simple answer.
Okay, thank you, sir.
Excuse me. One of the harm of the social media is cyberbullying. Cyberbullying gives sadness, anger, fear, depression, embarrassment. Even the patient, the adolescents are thinking of suicide. That is one of the harm the social media is and the WhatsApp and other things are. Of
Sir,
course.
can I interfere?
Please.
If permitted. Kalyani Patra madam,
Yeah,
as a
yes,
moderator,
sir.
I ask for your
Yes, sir.
Sanjay Ratnaparki sir, yesterday I had one child, 14-year-old girl, revealing pictures and videos on person unknown to her. She has never met him personally, just on Instagram. Okay, and all full body naked videos and pictures. Okay, and the parents came to know, and this girl now believes that this is the only person in the world who can save her, because the parents and the uncle and auntie, they physically gave her a beating and all that. The case was reported to cybercrime branch. The other person is an adult, 22 years old, living in Madhya Pradesh, and this girl has never met him. Okay, now she was under tremendous stress and now wanting to commit suicide. Now, do we teach her not to use mobile and look for some other recreation because she is already in that distress?
Yeah.
And
So
this was only yesterday evening's case who walked into my clinic, referred by a school counselor. Apna sir, आप भी कुछ input दे सकते हैं तो please बताइए.
Sir, for cyberbullying particularly, only 3 points to be told to these adolescents: stop, block, and tell. These are
Can
the
you
3
repeat,
points.
sir? Can you repeat?
Stop, STOP, stop. Block and tell. Stop the things जो आप WhatsApp आपके पास आ रहा है, block कर दो उस नंबर को, and tell to the parents and to the police.
And now this girl also showed her inclination for suicide, although she doesn't have a plan, which I asked, but then I want the parents to be with her, to be on safe side. I gave her some
counseling is the treatment for that.
Can I add here?
Yes, sir.
I think the today's teenagers should be taught about what is called as digital awareness and digital emotional intelligence, because there are a lot
teenagers,
of intense emotions.
Everybody.
Why teenagers? The parents also need to be taught.
Yeah.
Because Bapna sir मेरे साथ parenting में भी जुड़े हुए हैं, so you know. So I think digital awareness वगैरह, but that is not the topic for today. We are talking about stress, and because Bapna sir pointed towards cyberbullying, I wish to stress this particular point. And Nishikant Kotwal sir is raising everything.
No, I am only raising my finger, sir.
Okay, go ahead.
See, when we founded the state branch, we decided to have 4 modules. And the modules name, we have one of the module which Sanjay Ratnaparki is in charge of, is on cyber smartness. Whenever we talk about problems dealing with it and then things going wrong or depression, suicide, everything, before that comes down how to be smart. And this smart word is all accepted by adolescents. So in that particular module, which we are thinking of running all over Maharashtra in different AHA branches or webinars, and even all over India. We are trying to make them more smart. As in case of this girl, she had an identity most probably crisis, and somebody took advantage because in a whole net there are going to be predators. That those predators are trying to hook you. That is for sure. So the only thing is how to become smart, how to understand when problem is coming. As Bafna sir has rightly said, when to stop, when to block, when to tell. Telling is very essential because that is one of the one of the most difficult thing
Yeah.
because
Nishikant Kotwal sir, I really appreciate your inputs, but I
thank you.
have seen whatever cases of cyberbullying or sexual experimentations that I have seen, the common thing which I found in all the girls especially whom I have seen is lack of friends.
Hmm.
Can I add here, sir?
Yeah, please,
I
sir.
think I got disconnected and I got disconnected in between. What I told was about digital awareness is about emotional awareness in digital space. They are not aware about what they are feeling, what others are feeling.
Yeah, we
They
got it.
and they don't know how to respond. Basically, that awareness, about cyber psychology, cyber frauds, which are happening, all that is also. And we have developed a interesting workshop for teenagers, which we are going to schools on digital emotional intelligence, and which is, important to kind of they prevent all these problems
Yeah,
because.
I'm talking of something different, sir. That is a very good initiative that you have been taking. But what I am saying is, those children, those teenagers who do not have close friend circle or any sort of social interaction, they are at a very high risk of engaging into this type of cyber bullying because they are attracted towards the fictitious things, imaginary things, and they find that, and this is exactly what happened with this girl. She was denying that this fellow cannot cheat me,
अतुल
this
भाई,
fellow cannot.
Absolutely.
अतुल भाई, क्या आपको नहीं लगता कि एक ऐसा वर्कशॉप या ऐसी एक क्लास या ऐसी एक इस तरह का आयोजन साइबर पर करना चाहिए आपको?
सर आप बताइए, हम कर देंगे सर, आप मालिक हो, हम तो बस बैठे हैं यहाँ
Because
पे.
this is a burning topic, let me tell you.
Yeah, it's a burning topic. It's very common, and only 1 out of 10 cases are revealed to us. There are 9 who are suffering in solitude, and that is very, very pathetic. As Maha IIP AHA activity, Kalyani Patra Madam being today's moderator, I request you to please take a note of this.
Yes,
That,
sir. Yes, sir.
but our next month's topic is probably we have talked about so much of mental health and all that. But next month's topic probably I don't have Sulbha Pawar and other organized team out there. It's basically based on endocrine issues in teenagers. So if it is done, we will let you know. If there are any questions, because already we are 2 minutes
Sir,
over.
one more thing. You were talking of that girl, which is very important. Every life is important.
Yes, sir.
One thing is that the things should be avoided, and whenever such thing happen,
Yes, sir.
or even sexual abuse also, they need to be gradually directed that their life is important. The past is past. These things are going to happen with many. You have to stand forward and become the path leader to those who are not getting affected. Anyone with strong trauma is always become the great volcano inside. He can direct the whole issue. That
So
should be that.
the take home message here could be, if permitted by Kalyani Patra Madam, that stress is universal, number one. Stress can be acute, very acute, or emergency stress. When the parents came to know that the child is going to commit suicide, they were not bothering about what is their reaction to stress and all that. They were just reacting. It's like आग लगी है तो भागो, without thinking कि आप fire exit की तरफ जा रहे हो या आग की तरफ जा रहे हो. So there are stages and the triggers, and we need to keep our minds cool to address those triggers and take the proper reactions and actions according to it. With all your due respect and thankfulness, I say that now our time is actually running short. And there are any questions, maybe we can conclude. Wonderful three speakers we had, beautiful participation. Kedkar sir, thank you very much.
Thank you.
Ratnabarge sir, it was late but थेट आपली चांगली भेट झाली. आणि Bhapna sir, there is no doubt about it. We all are going to meet in Nasik in September end for our Adolescence Con. I hope you all join us. And I take your leave now. So thank you very much. Please conclude, Kalyani madam.
Yeah, thank you. Thank you, Kanikar sir, for shortening this talk of stress, which was very important, and a lot of audience was glued to it till end. I thank all the esteemed faculty, Dr. Pukhraj Bafna sir, Dr. Sanjay Ratna Farke sir, and Dr. Sandeep Kekar sir for enlightening us with their knowledge. And we take your leave. Thank you. Thank you all.
अतुल भाई,
Yes sir.
राहों पे नजर रखना,
जी सर.
होठों पे दुआ रखना,
क्या
आ
बात
जाए कोई शायद दरवाजा खुला रखना।
क्या सर, मैं तो कब से खुला ही रखा हूँ,
अरे
रात में चोर
एहसास
आते
की
हैं,
शम्मा को
लेकिन मुझे
सदा
लग रहा
जलाए
था
रखना।
चोर भी आया था तो
सुनो भाई,
लग रहा था
सुनो।
बापना सर ही आए हैं.
सुनो, एहसास की शम्मा को सदा जलाए रखना, कुछ अपना पता रखना, कुछ मेरा पता रखना।
क्या बात है, क्या बात है, क्या बात है. Thank you very much, sir.
Thank you.
Thank you, sir.
Bye bye.
Thank you all.
Enjoy your
Bye.
Sunday.
Bye.
everyone.
Bye bye.